love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
In with this week's edition of Health Matters, I am your host, Shevanee Nisbett, health educator at the Health Promotion Unit. Vaccination Week in the Americas is celebrated April 25th to May 2nd this year. The theme for this year is Boost Your Power, Get Vaccinated. Vaccinations are designed to boost your immune system and protect you from pathogens and diseases. Vaccinations do not make you sick, but prepare your body to fight off diseases. To give you some insight on vaccinations and more so immunizations, as well as to let you know what we at the Ministry of Health will be doing for Vaccination Week in the Americas, I have decided to have a short conversation with Nurse Deslyn Whyte, who will give us a little more information on vaccinations and immunizations. Nurse Whyte, thank you for having me here to do this interview.
It's my pleasure.
Okay, we're going to start off with asking you, what are the different types of vaccines offered on the island and where can one get these vaccines?
Okay, we have a variety of vaccines available, and first let me tell you that all vaccines are available at the various health centers throughout the island. The vaccines available, we have the BCG, we have pentavalent, which is the 5-in-1 vaccine. We have 5 vaccines in one.
Okay.
Yeah. We have the polio, we have the MMR, we have the DPT, we also give the hepatitis B and the DT. Well, I said pentavalent, which is a 5-in-1, and that 5-in-1 is the DPT, the hepatitis B, and the Haemophilus influenza. So those are the vaccines that we have available.
And that 5-in-1 vaccine is received, but it's given to adults, children?
No, the pentavalent vaccine is given to children under 1 year.
Under 1 year. Okay. And tell us about the importance of immunization.
Importance of immunization. Okay, immunization is very important, and important because it helps to prevent those infectious diseases that we are already having under control within our parts of the region and that we don't want to have a resurface. And this could only be done by immunization. Immunization is also important not only for the individual but also for the community, because this helps to keep the spread of the disease from within the community once we are immunized.
And what are some of the diseases that you could help prevent by getting immunized?
You have the tuberculosis, we have the hepatitis B, we have the diphtheria, the tetanus, pertussis, polio, measles, mumps, rubella.
Okay, good. And what age does immunization start?
Immunization begins as soon after birth as possible. Here in the Federation, we usually start vaccination about week 4 weeks. And that is because immunization is started when the children come to the health center on the first visit. Oh. So usually they might get BCG on their first visit. Usually they get BCG on their first visit. And their first visit is usually the first clinic day after discharge from hospital.
Okay. And Nurse Whyte, what is the scheduling for immunization?
Okay, immunization scheduling. As we spoke before, BCG is the first vaccine that the children usually receive. Okay. But however, in sometime later down this year, we would start introducing the hepatitis B at birth vaccine. We have not yet started, so for now, the BCG vaccine is the one that we would have been given. The children would have given first, and remember I said within the first 4 weeks, they usually get the BCG vaccines. Then after the BCG vaccine, we start with the pentavalent and oral polio vaccines. First pentavalent is given at 2 months, along with the oral polio vaccine. Then we have a second dose at 4 months and a third dose at 6 months. And all these doses are given with the polio vaccine. Pentavalent is only given in 3 doses. So once a child has gotten 3 doses of pentavalent, they would not be receiving any more pentavalent vaccines. After the pentavalent doses with the oral polio, we have at age 1 year, you get the first MMR vaccine. That is the measles, mumps, and rubella. At 1 year and 6 months, they receive a booster dose of the DPT and the oral polio vaccine. So note, remember with the pentavalent vaccine, they would have been getting 5 in 1. So we are finished with the pentavalent now. So at 18 months, they just get the DPT, which is the diphtheria, the tetanus, and the pertussis. That's the booster dose that they would get along with oral polio vaccine as well. At age 2, they would get a booster dose of MMR, which we call the second MMR, and then they would be covered with the MMR vaccines. On entry into primary school, we say about the fifth year, when you enter into your 5th year, we give another booster dose of the DPT and the polio vaccine. So this would take them through their school life. So through primary school, through secondary school. When leaving secondary school now, we usually give a booster dose of just the DT vaccine. So it means that they no longer will be getting the pertussis. They will just be getting the diphtheria and the tetanus with the polio vaccine. And we also have the hepatitis B, as we said, but hepatitis B, because the children would have been getting it from birth coming up, they wouldn't need to be getting the boosters. So the hepatitis B is just to be given to persons who would have not been covered with the hepatitis B.
And these last still for life? Or most
Yes,
of it?
yeah, most of life, yes.
For immunization week, what are the target vaccines?
Immunization week will be starting the 25th April to 2nd May.
Yeah.
And during immunization week, we usually look at various vaccines. Sometimes we do one vaccine, sometimes we do more than one vaccines. And we look at a target population for these vaccines. So what we'll be doing for this year's immunization week in the Americas, we'll be focusing on those school-age children and infants who have not been covered, who have not had all their vaccines that they should have had for their ages. And these vaccines include the MMR, the polio, and some children, the hepatitis B vaccines, who wouldn't have been getting it, who wouldn't have got it. And most of the time, there would have been children who would have migrated to Nevis. We will also be doing the hepatitis B vaccines for persons who would have been outstanding for hepatitis B. As last year, we focused on the hepatitis B vaccine in adults. So those adults who would not have finished their coverage, they would be now coming back to finish their coverage.
And so how are you planning to cover those people who haven't covered? Like how are you reaching out to them?
Okay, so for the school children, we will target these schools.
Okay. So
the schools would already know a list would be sent to the school, and the school would send the children down. For the other children, parents would be contacted as well. When we make home visits, we'll visit the preschools or we'll visit the centers, the daycare centers, and we'll let the caretakers know, and they also would inform the parents for us, because sometimes you're unable to get in contact with the parents. For the adults, we would do the same thing, try contacting them at their workplace, and also via the media.
So you have a list of people?
Yes, we have to record everyone who we give vaccine to. The date when you give it, the type of vaccine, and the batch number.
Okay.
Vaccines, yes.
Okay. How cooperative are the parents and the teachers in getting the students and the adults to get their vaccinations?
The public is generally cooperative. Parents, at least some parents, only want to bring the children to health center when they know that they are supposed to be receiving vaccines. So we have very cooperative parents. Some parents, sometimes you have to really encourage them, because they would be hearing a lot of things other on the media. Everything is on the internet now, so they would be reading up different studies and stuff. So you have to encourage some, but generally they are cooperative.
What is the cost of immunization?
Okay, in St. Kitts Nevis, the cost of immunization is free, except for the hepatitis B vaccine. In Nevis, we charge $25 per dose of the hepatitis B vaccine, but all other vaccines are given free of cost.
And what is the schedule for the child welfare clinics for the various health centers?
Okay, most of the health centers has 2 child welfare, that's the infant clinics, on a monthly basis. We have Gingerland and Brown Hill having their clinics on the first and second Tuesday of every month, and Butler's having on the first Tuesday of every month. That's for the infant clinic. We have Charlestown having it on a Wednesday, first and second Wednesday of every month, and Cotton Ground Health Center on the first and second Thursdays of every month, and Combermere Health Center on the first Thursday of every month. Those are the infant clinics. We also have toddlers clinic, and those are toddlers clinic is done 4 times per year.
Okay.
So we do it on a quarterly basis. Yes. For Gingerland and Brown Hill, we do on the 3rd and the 4th Tuesdays. For Gingerland and Brown Hill, we do it in February, May, August, and November. Those are the months that we do it. So with the infant clinic, it's every month. But with the toddlers clinic, even though we say once per quarter, we have it on specific months.
Oh, okay.
Yes. So for Gingerland and Brown Hill, as I said, so we do it on the 3rd and the 4th Tuesdays per quarter. And for Charlestown, it's the 3rd and 4th Wednesdays. And Cotton Ground, the 3rd and 4th Thursdays. Butlers and Combermere, however, their schedule is January, April, July, and October.
Okay.
And they do those on the 2nd Tuesday and the 2nd Thursday of those months that they would be doing their toddlers clinic.
Okay. And then for these clinics, you normally have a good turnout for?
The clinics are flexible. Some months, definitely you would have a greater influx because especially the August month.
Okay.
Because everybody is bringing their children to make sure that they have the immunizations ready for school, for entry into school.
Right.
So usually during August and even May, because sometimes you have to do registration before May. So some of those parents who we couldn't get before, they will now be coming because the children need to be immunized for entry into school. Yes.
Okay, and how do you go about, you guys record immunization?
Yes, every immunization that is given is recorded, and we record it in our child take-home card.
Okay.
That's a card, it's a booklet now that we give the parents to take home, and we call it the immunization passport. So they have that, so it's recorded in that. It's recorded here in the health center in the record book that we have. We have a duplicate to what we give the parents. So we have that, as well as we have other registers that it would be registered in.
Okay, and if the parent or the child, I guess, when they get older, were to lose the card, is there a replacement? Can you get a replacement?
We do replacement cards, but we encourage parents to take good care of their cards, because especially those that we have now, they have everything about the child in it. So we advise them to hold it safe and keep it dry. Because if the child is to go to a doctor and the doctor picks up the take-home card, the doctor knows everything about the child. So it goes with the child from birth until.
So it's important too.
So it is very important for them to secure it and ensure that it is in a good state.
Okay. And I forgot to ask you earlier when you were speaking about giving the injections from birth, where on the child would you normally give injections?
Okay, so for the BCG, we usually give the BCG on the shoulder area, right?
Okay.
And it's given under the skin. We give it on the right arm. So every child should have their BCG given on the right arm. Some persons, well, for viewing purposes, may have their BCG on the left arm because we used to be giving it on the left arm.
Why you change?
We change because I think it's universal within the Caribbean that everybody is giving it on their right. So
Okay.
something like that,
Okay,
yeah.
okay.
It is not like anything medical why it would have changed.
Okay.
It would have just been so that everybody is on the same. The pentavalent vaccines are given on the lateral aspect of the thigh. So we give it on different opposite thigh each time.
Okay.
And then the other vaccines will be given in the arm again, but this time in the deltoid muscle. Not under the skin, but in the muscle itself. And all other vaccines, that is how it will be given. So we only give the pentavalent vaccines in the leg. All other vaccines from when they hit age 1, we start getting it in the deltoid muscle. That's the one on the arm.
Okay. And are there any final words or words of advice to the general public, whether it be on immunization itself or for vaccination week?
Okay. Well, as we said before, immunization is very important, and for the health of the country, the health of yourself, and the health of society, we are encouraging persons to be immunized and to immunize your children. Cooperate with the nurses or the medical professionals as it regards to immunization. Remember to take care of yourself and to live as healthy a life as possible. And by doing this, we mean the right diet, proper exercise, and for those on medication, ensure to take your treatment, as a combination of these three ensures a healthy life. The wealth of the nation depends on the health of the nation. Thank you.
And that has been this week's edition of Health Matters. I would like to thank Nurse Deslyn Whyte for giving us a short but informative session on vaccinations and immunization. We're encouraging everyone to immunize yourself and your children so we could have a healthier nation for a wealthier nation. Vaccination week is from April 25th to May 2nd this year, and the theme is Boost Your Power, Get Vaccinated. So everyone, please get vaccinated. Thank you for listening. I am Shevanee Nisbett, your host, health educator from the Health Promotion Unit. The fruit of the week is banana. Banana is full of potassium. Have one banana every day this week. Bye.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise